This is our last lecture in the respiratory system. In the previous lectures, we looked at the process of gas exchange and the blood flow through the lungs and the capillaries. And then we introduced this aspect of ventilation, and we looked at ventilation as a product of musculoskeletal involvement, particularly muscles within the abdominal. And when we start thinking of the abdominal muscles, words like the core start coming up, and we look at this concept of spinal stabilization. And this is really the first part of our conversation when we start exploring what this concept of the core and core stability and spine stability refer to. If you recall, when we look at ventilation, breathing, bringing air in and out, it's a product of changes in volume in the thorax or chest wall cavity. And that's primarily done by the diaphragm and supported by the abdominal muscles. And so when I pull that plunger down, the abdominal muscles are contracting and it's putting a downward pressure into the tissues. And then I get this relaxation of the diaphragm. And so based on this pressure differentials between contraction and relaxing, I'm changing pressure environments both in the lung cavity and in the abdominal cavity. The primary thing here is that as the diaphragm contracts, it does exert a downward pressure. And this downward pressure causes the abdominal contents to bulge out, and that's why this is called belly breathing. So as I'm breathing in, that's because my diaphragm is pushing down, drawing air in like a vacuum or a syringe. And as the exchange for that, or the trade-off for that, is that my diaphragm's pushing down on my guts, and so my belly sticks out a little bit. Right? And you kind of see here all the stuff that the abdominal muscle is putting pressure on. But what if there was no relaxation of the abdominal wall? So what if the diaphragm contracted down, and the other musculature that you see here, like the transversus abdominis or the obliques, they did not relax. And so you can see here the diaphragm at top, and you can see the pelvic floor at the bottom. And then you can see the deepest layer of the abdominal musculature here called the transversus abdominis. And then in the back supporting the spine is the multifidus, and it happens to be the deepest back muscle. And what you start to see here is this like bean-like shape here that is made up this diaphragm, and you can kind of see this closed cavity here from the side view, and from the front here's the diaphragm, and you kind of got this belt that's going around. You have your pelvic floor at the bottom. So here's your transverse abdominis. It looks like a belt, right? You have your diaphragm on top, the parachute, and you have the inverse bowl at the top, and you have your bowl at the bottom for your pelvic floor. And what we're starting to see here is this capsule that's contained between the diaphragm and the pelvic floor. And this, when you look at the downward pressure that's happening during breathing, during diaphragm contraction, this is typically through relaxed tissues here, and this is bulging out. But if this was to pressurize, you start to get into some spinal stability aspect. Real quick, when you look at gas, liquid, and solid, there's not a lot of space there, so it's not very compressible. When you look at liquid versus gas, there's a little bit more space in liquid, but not really a lot. And so when you look at gas, it has a lot of empty space. And so gas is fairly compressible. Liquid's not. Liquid is almost like a solid where you can't really compress it too much. And so if I look at the chest wall and the abdominal contents, I have the heart here, but mostly lung tissue. And this is empty gas, which it's supposed to be, right? We want air from the environment coming in. And then everything below the diaphragm is liquid. So everything above the pelvic floor, above the diaphragm, and then constrained radially around from the transversus abdominis, this is mostly liquid. And if I look at a water bottle that's mostly air, I can crush that fairly easy. Even if I put the cap on there, I'm going to get some yield. But if I have a water bottle that is full of liquid and I have a cap on tight, that's going to resist a lot of I can stand on that thing, and it's going to bear my body weight. So what if we start to visualize the capsule that's constrained between the diaphragm, the pelvic floor, and around the transverse abdominis as a pressurized water bottle, right? And that's exactly what we look at. When we look at the guts, sometimes when you look at these anatomical aspects, they show all these tubes, right? But like blood vessels are tubes, and that's true if they're full of stuff, but they're not full of air. This is the tubes depicted in anatomy images are really lies. There isn't any empty space there at all. If there is space there, it's called gas. You definitely don't want an air bubble in your artery. So this is mostly liquid, right? And if it's not, it's usually flat if there's not stuff in there. And so your guts really are a pressurized water bottle if the cap is screwed on tight, right? So the diaphragm, And the cap at the bottom, or the bottom, is supported, so the pelvic floor musculature, and there's no breaks in the wall, so the transverse abdominis, and it's upright and rigid via the multifidus. And this mechanism here of your diaphragm, transverse abdominis, pelvic floor muscles, and the multifidus is referred to as the inner unit. Now, we'll talk about the core, but most people have at least a basic understanding of the core, which is the muscles involved in stabilization and whatever muscles they may be. But if the core had a core, which it does, this is called the inner unit. And this makes the basis of spinal stabilization. You know, when we talk about what the core is, most people want to say it's the abdominals or the back musculature. But then I always ask, like, is it really just the abdominals or the back musculature? And it does include the abdominals, but it's not just the abdominals. And there's people that say that they have really strong abs, right? They can do a lot of sit-ups, or they have good external obliques, internal obliques. But if you look at the inner unit, outside of the transverse abdominis, you don't see rectus abdominis listed. You don't see internal, external oblique listed. You see diaphragm, multifidus, and pelvic floor. So how many people have been doing multifidus exercises or diaphragmatic exercises, or some people are doing pelvic floor exercises, and some people are doing transverse abdominis? If you do any kind of recent literature research on spinal stability, back pain, performance, transversus abdominis and multifidus, and then pelvic floor musculature, all of these four right here are the key. And this is why people can have crappy inner units and have really strong abs and say, oh yeah, and I do core every day because I can do 1,000 sit-ups. Who cares? And it's not so much how strong these muscles are, but how coordinated is the diaphragm with the pelvic floor, with the transverse abdominis. The National Academy of Sports Medicine would always say, like, you should draw your navel in, which is, I think, totally wrong cue to give, because you actually want this to pressurize. And if you look at the use of exercise belts, like you see people using weight training belts, what they're trying to do is they're mimicking or helping to support the inner unit. They're able to bear down on pressure so they can pressurize the spine. And basically you're getting a offloading of the spine through the inner unit, because this is a water bottle that's being pressurized and is incollapsible. And if you actually pressurize it more, like you're trying to push down or suck in or stabilize all this whole capsule, you can actually get an upward force that is resisting that downward pressure of the spine. So if there's an inner unit, there must be an outer unit. And if you recall from the musculoskeletal lecture, we talked about looking at the skeleton as really the shoulder girdle interacting with the pelvic girdle. And that when we looked at the regional interdependence, that movement in the left leg is coupled with movement in the right upper extremity. Extending, so extension, and you're getting a simultaneous flexion, and so the pelvic girdle and shoulder girdle are rotating in opposite directions. That is the core. So everything that's integrating the shoulder girdle, which is basically the thorax, and the pelvic girdle, which is the pelvis. And so the pelvis is rotating in one direction, the thorax or the shoulder girdle is rotating the opposite direction. You're getting load transfer here through the red line, and then you're getting the opposite loading or release of loading through here, and this is all driven by the spine, by the spinal engine, through this opposite and these opposite rotation of the shoulder and pelvic girdle. So if the inner unit was the stabilization of the in-between the shoulder girdle and the pelvic girdle, and again, no rectus abdominis, no obliques, but the coordination of this system to transfer loads from the shoulder girdle, pelvic girdle, and maintain this upright posture, what the outer unit are different types of sling systems or muscular systems that are working in conjunction with that right leg, left arm, and opposite leg, contralateral arm, right? And so you have these, and you can start seeing now, these are muscles of the core. So hip abductors are core muscles. Your hamstrings are core muscles. Your quadratus lumborum is a core muscle. And you can see this relationship that's here. And I have one example. We're going to get more into this in KIN 231 when we look at programming, and especially 214 when we look at exercise technique and instruction. But this is just the posterior oblique system. And when we look here, you're looking at the contralateral lat to the ipsilateral glute. And so you have your right glute and your left lat, because the left arm is coming to extension as the right leg is going to extension during gait. And it creates this coupled force here is what I'm looking for here. And then this is just looking through gait. If we're looking at it as a squat or a deadlift from a standing force, you'd have this glute contracting there, and you'd have this glute working with the lat there. You're getting huge amount of force output. The first and second largest muscles of the body working in conjunction for spinal extension and stability. And so when we start looking at like core coordination or system, are your glutes activating or contracting the way they're supposed to? And then are they timed appropriately with the lats? It's not so much how much force is being produced, but can it be coordinated in that aspect? So you can do sit-ups till you're blue in the face and you can have the weakest core in the world because you have poor coordination, not only in the posterior oblique system, but we always start with the internal, with the inner unit, looking at that mechanism there of diaphragm, pelvic floor, multifidus, and transverse abdominis. So you can kind of see the force lines here, clamping through the SI joint, through the thoracolumbar fascia, and that this is that sling system there. So again, we'll get into more details with the sling systems, but just keep in mind that that this all starts with the inner unit, and we look at spinal stabilization from similar musculature that's involved in respiration, and understanding that the diaphragm is exerting a downward pressure, and for respiration, it's trying to create an increase pressure differential by increasing the chest volume, but at the same time, it's also pressurizing the abdominal contents. As long as the transverse abdominis and pelvic floor are all working in unison, the spine is offloaded and creating spinal stabilization. And if you have a weak link in any one of these muscles, you're going to end up with abnormal stresses through the connective tissue. So then you end up with like back pain or pelvic issues or lack of range of motion through deep squatting. And this becomes now your source for intervention. So hopefully that made sense. Again, this wraps up respiration and the muscles that are involved in that.